Calf raises is one of our most essential exercises that we're going to be using with a lot of our individuals, athletes, and especially our runners. So for a calf raise, we want to make sure that we're hitting the right areas. And so I'm going to start by talking about what we're essentially looking for in terms of gait, and then move that into practical practice of use for calf raises as an exercise. So I might ensure that that individual has the ability to perform a calf raise first. Let's say they get through their capacity test, they can do a double leg. We're on our way to looking at a single leg version of this. In terms of gait, we're looking at the ability to move from a pronated position into a supinated position, looking at mid to terminal stance and push off for gait. So if we're on a single leg calf raise, I like to utilize a calf squat wedge to position the patient in dorsiflexion, just like they would be at the end phase of their gait. So for this, we've got a full foot on the wedge. And we're going to position the front foot halfway onto a step in front of us. I might ask the individual to just give me a couple calf raises and show me what that looks like. From here, I'm looking at how is their heel moving? Are they moving into relative inversion of that heel? Is there something gross in terms of where they're moving, whether it's off to the lateral aspect of their foot, more onto that medial aspect? I'll question, where are you finishing through? In terms of gait, we're typically wanting to look at a finish all the way through that big toe to give that efficient push off for gait. So as they're going through their calf raise, they can use something to hold on to take some of the balance out, just to see what the calf's ability to produce force is. As I'm cueing this initially, I'll have them make sure they position their weight directly over that back foot and that they're going straight up and down, as opposed to translating forward, which is going to take some weight off of that back foot. Okay. Then I'll ask questions involving, okay, where do you feel the finishes through your foot? Some will find that they're finishing through the ball of their foot. Some will say they're finishing off onto the lateral digits of the foot. And some will find what we're looking for is finishing through that big toe. Okay. If someone tends to invert their calcaneus or ankle as they're going out, that might tell us we're missing some of the ankle everters during the calf raise. So cueing, I want you to finish over your big toe. I like to use the external analogy of, imagine there's a $100 bill under your big toe and you want to squish that down and prevent me from taking that out from under you. Okay. That will usually get them to find what we're trying to look for in regards to finishing through that big toe. And that's essential for getting activation through the foot intrinsics and that first ray. So we're not just getting a calf exercise, but we're also getting a foot strengthening exercise through this, from our ability to move from pronation into supination. So let's say they're able to hit their capacity, reaching about 25, give or take, based on their age range. Then we might start to add weight or look at specific variations to target certain areas that we want to target. So just based on positioning of the calf and foot, we can target medial or lateral bias with this exercise. If I want to target the medial aspect of the calf, I'm going to rotate this foot out into external rotation, just like as if I was going to make an inside cut. This is going to utilize the medial gastroc and ankle plantar flexors a little bit more than when it's in a neutral or internally rotated position. I can also rotate this inwards and perform this working towards the ankle everters a little bit more, or the lateral gastroc. Okay. If someone is having a difficult time finding that inside of their foot, we can utilize different strategies such as adding a towel placement or towel or a wedge or something additional under your big toe or medial foot so that they can feel the ground pulling up on them so that they can find that extra pressure towards the inside. We can also utilize weight strategies to work on this too. If I want to work a little bit more of that medial bias, I might ensure that they're holding this weight on the opposite side so that they can get more pressure down through that medial aspect of the foot and ankle and calf to add additional load to it. And vice versa for holding this on the outside or the same side as the calf that's working. As we're going up into heavier loads, we're often wanting to get our field sport athletes or even runners doing very heavy calf raises for sets of 5, 6, at least as low as 8 reps. And grip strength might become an issue for holding on to weight while also maintaining some balance component or taking some of the balance off so that force production can be the highest as possible. I'm looking at starting to introduce the safety squat bar, or for patients who don't have access to that one, they'll use a Smith machine, and we can position them right under the weight, use the racks to hold on to ensure that they can push up as much as they can and lower back down without having to worry about the control aspect. So I do want to add also other things that we're looking at is the mobility in the great toe. Are they having a sufficient amount of great toe extension to allow them to go through the necessary range when we're working through a deficit? If not, then that's something that we want to make sure we're working on in conjunction with building up calf strength. So this may be a time where we're utilizing a calf raise straight from the flat ground where we're not going to initiate so much great toe extension. Or if an individual is trying to build calf strength and that might be a slightly limiting factor, we can utilize like a plate so that we can create still a deficit going into more dorsiflexion without creating such a great extension moment that's going to bother their toe.